Bladder leakage, or urinary incontinence, is an issue that affects millions of people worldwide, both men and women, and yet it is often surrounded by silence, embarrassment, and a sense of helplessness. The truth is that, for many, this problem is not simply a normal part of aging that must be accepted. It is something that can be managed, reduced, and in many cases, stopped entirely with the right techniques and training. One of the most effective strategies that has emerged from physiotherapy and pelvic health research is something known as the Knack, a simple but powerful method that, when done correctly, can stop bladder leaks instantly during moments of pressure. To understand why this works, we first need to understand what causes stress urinary incontinence, the type of leakage that happens when you cough, sneeze, laugh, lift something heavy, or even during sudden movements like standing up quickly. In these situations, pressure inside your abdomen increases rapidly, pushing down on the bladder. If the pelvic floor muscles and urethral sphincter cannot respond quickly enough, urine can leak out. This is where the Knack comes in. It is a preemptive action you take to engage the right muscles at the exact right moment. Before the pressure hits, imagine your bladder like a water balloon, and your pelvic floor muscles like your hand holding the knot closed. If you suddenly squeeze the balloon, water will push against the knot. But if you tighten your grip before squeezing, nothing leaks out. The Knack uses this principle in real life. Research conducted by pelvic health specialists has shown that by contracting the pelvic floor muscles just before and during activities that cause pressure, you can significantly reduce or stop leaks. This is not just anecdotal. It has been tested in controlled physiotherapy settings, and the results are encouraging, especially for women who have had children, people in their later decades of life, and even younger athletes who experience leakage during high-impact sports. To perform the Knack, you first need to know how to correctly contract your pelvic floor muscles. These are the same muscles you use to stop urination mid-flow, but practicing during urination is not recommended except to identify them once or twice, as regularly stopping urine midstream can lead to incomplete bladder emptying and other issues. Instead, you should practice pelvic floor contractions when you are not urinating. The contraction should feel like a lifting and squeezing sensation inside your pelvis, not a tightening of the buttocks or thighs. Once you can reliably activate these muscles, the key is timing. If you are about to sneeze, cough, or laugh, quickly squeeze and lift your pelvic floor muscles just before and hold through the action, then relax. At first, this might feel awkward or hard to time, especially if the sneeze or cough comes suddenly. But with practice, your reaction speed improves. Many people who use the Knack regularly find it becomes automatic, so they instinctively contract at the right time without thinking. It is important to note that the Knack is not meant to replace long-term pelvic floor strengthening. It works best in combination with a regular program of Kegel exercises, which build muscle tone and endurance. Over time, the stronger your pelvic floor, the more effective your quick contractions will be when you need them most. In some studies, participants who learned the Knack and practiced daily pelvic floor exercises reported over a 70% reduction in leakage episodes within just a few weeks. One common question people have is whether this technique works for all types of incontinence. The answer is that the Knack is most effective for stress incontinence, where leaks occur due to sudden pressure on the bladder. For urge incontinence, which is caused by sudden bladder contractions and an urgent need to urinate, the technique can sometimes help, but is less consistently effective. Urge incontinence often requires bladder training and lifestyle changes. In addition to pelvic floor work, the Knack is also particularly valuable for postpartum women. After childbirth, the pelvic floor muscles and connective tissues can be stretched and weakened, making leaks more likely. By teaching women the Knack soon after delivery, physiotherapists can help them regain control more quickly and prevent the development of long-term incontinence issues. Even in men, especially those who have undergone prostate surgery, the Knack can play a role in recovery by training the pelvic floor to activate in sync with abdominal pressure. Practicing the Knack is simple, but consistency matters. Start by identifying situations where you usually leak. Maybe when you bend down to pick something up, when you jog, or when you get up from a chair. Make a conscious effort to contract your pelvic floor before and during these actions. It can be helpful to visualize the muscles lifting upward and inward as you engage them. Some people also find it beneficial to pair the contraction with a gentle tightening of the lower abdominal muscles, as long as this doesn't lead to breath holding. Breathing is important. You want to exhale gently during the action rather than holding your breath, which can increase pressure. While the Knack is a technique you can start using immediately, its benefits grow over time as your muscle coordination improves. In the beginning, you might still have occasional leaks, especially if the pressure is very strong or you are caught off guard. This does not mean it is not working. It simply means your muscles and nervous system are still adapting. Over weeks and months of practice, you will likely notice leaks becoming less frequent and less severe. Alongside the Knack, certain lifestyle adjustments can further improve bladder control. Maintaining a healthy weight reduces pressure on the pelvic floor. Managing chronic coughing, whether from allergies, asthma, or smoking, prevents repeated strain. Staying hydrated is also important. Even though it might seem counterintuitive, drinking too little water can make urine more concentrated, which can irritate the bladder and increase urgency. Avoiding excessive caffeine and alcohol can also help, as these substances can irritate the bladder lining and act as diuretics, increasing urine production. It is worth acknowledging the emotional side of bladder leaks. Many people feel embarrassed or anxious, which can lead to avoiding activities they once enjoyed. Learning the Knack can restore a sense of control and confidence, allowing you to laugh, move, and live without constant worry. This mental shift is as valuable as the physical improvement. Medical professionals who specialize in pelvic health emphasize that incontinence is not a personal failure, it is a common, treatable condition. The Knack is one of several tools available, and it stands out for its simplicity, low cost, and immediate applicability. There is no special equipment required, no invasive procedures, just your own muscles and the knowledge of how to use them strategically. Over time, you might find that using the Knack becomes second nature, just as someone might automatically brace their core before lifting a heavy box. You will reflexively contract your pelvic floor before coughing or sneezing. This automatic response is the ultimate goal. It means you have retrained your body to protect against leaks without conscious effort. For those who want to take their results even further, working with a pelvic floor physiotherapist can be invaluable. These specialists can assess your muscle strength, coordination, and endurance, and provide personalized feedback on your technique. In some cases, biofeedback tools are used, giving you a visual or auditory signal when you are contracting the correct muscles, which accelerates learning. Technology is even making its way into home training, with apps and small devices designed to guide pelvic floor exercises. But even without these, the Knack remains accessible to anyone willing to learn and practice. It is a reminder that sometimes the most effective solutions are the simplest. If you are struggling with bladder leaks, adopting the Knack could be a turning point. It gives you a way to take immediate action in situations that used to cause frustration and embarrassment, combined with ongoing strengthening and healthy habits. It can help you reclaim comfort, freedom, and peace of mind. The journey might begin with a single intentional muscle squeeze before a sneeze, but over time, those small actions add up to big changes. No one should feel resigned to living with bladder leaks, and the Knack offers a clear, research-backed path toward regaining control. Whether you are at home, at work, or out with friends, knowing you have a technique ready at any moment can make all the difference, transforming how you move through your day and how you feel about your body's capabilities.